Check, check. Everybody hear me? Good afternoon, everyone. My name is Marlon Platt, and I'm the Executive Director for the African American Male Wellness Agency. We are excited and delighted to have everyone tuned in and here today as we announce our It's Our Problem Too Opioid Campaign project in partnership with Franklin County Public Health. The African American Male Wellness Agency has been around for going on 18 years, doing our part to close the health disparity gap in the African American community through education, awareness, and free programming. We've been addressing health disparities in our community for centuries, for decades, and we want to continue to do our part by addressing different needs as they arise. One issue that we've seen come up more recently here is the opioid epidemic. What we do know is that over the last year, there's been a 35% increase in African American overdose due to opioids. This is our problem too. We do understand that traditionally this has been seen as a rural and suburban issue, but we want everyone to know that this is an issue right here in our communities. We are excited to venture into this new partnership with Franklin County Public Health. We have worked with them previously through COVID-19 campaigns, as well as on our annual African American Male Wellness Walk. We are delighted to do this work, and we are excited to change our community for the better. Without further ado, I'd like to bring up Public Health Commissioner, Dr. Joe Mazzola.
Thank you very much, Mr. Platt. Good afternoon, everyone. Welcome to Franklin County Public Health. It's a real honor to have everyone here this afternoon. Before I start, I want to thank our staff, and I want to thank the African American Male Wellness Agency for your partnership and your collaboration. We are really honored to have you here today for this announcement. As was mentioned prior, we have a significant public health crisis happening in our community. It's been said that there is an epidemic within the pandemic that's occurring, and that has to do with the issue of addiction and substance use disorder. We have seen a year like no other, and as it relates to overdoses, Franklin County has had really significant impacts as it relates to overdoses here in our community. Unfortunately, we have seen too many times where we have seen surges in overdoses and overdose deaths in Franklin County. I want to read to all of you a couple of the highlights of a report that the Franklin County Coroner's Office released recently, which really, I think, highlights the severe impact that addiction is having here in Franklin County. As you look at 2019 to 2020, if you look at between March and September, of 2019 and 2020, we had 354 victims related to overdoses in that time in 2019. In 2020, there were 488 victims of overdoses here in our community, which is just staggering. When you look at the racial disparities that are happening, as was mentioned, the change between 2019 and 2020 has been also very, very concerning. You look at the largest increase with respect to overdoses, 41% for the Hispanic group, 38% for whites, and 35% increase for African Americans. So we are seeing just a tremendous toll that addiction is taking on our community, which is why it's so important that we at Franklin County Public Health continue to partner with organizations like the African American Male Wellness Agency. We are in year 2 of a multi-year, multi-million-dollar grant with the Centers for Disease Control. It's called the Overdose Data to Action Grant. And that grant really is about how we can, from a prevention and an education standpoint, engage with our residents. And this kind of partnership that Franklin County Public Health has with the African American Male Wellness Agency is exactly the kind of partnership that we need to have to make sure that we are reaching all of our residents here in Franklin County. As part of this grant, we've also launched a campaign called Recover for Life. Recover for Life is really all about the journey of recovery. As when we talk about addiction, recovery is a lifelong journey, and Recover for Life is our campaign to really bring awareness about opioid education. And our partnership with Recover to Life and the African American Male Wellness Agency is really going to take that message to the community, and we're excited to be able to do that with churches and barbershops and salons and other community conversations. And so we also are very excited about the opportunity to be able to distribute more Narcan in our community, and I know this partnership is going to help us do that as well. So there's a lot of important work still left to be done, but as you have heard, and we can provide more information, what we have seen over the last year is something that we've never experienced before. COVID-19, of course, has had a tremendous impact on our community, devastating impact on our community. But when we think about mental health and addiction and substance use disorder, we know that we are losing so many of our neighbors, so many of our family members to the issue of addiction. And it's the partnerships that we're going to be talking more about here today that are just so vital to make sure that we're getting information and resources to our residents, because we have to turn the tide on this. These trends simply cannot continue. And Franklin County Public Health, we're going to do everything that we can to continue to partner with organizations and make sure that we, again, provide that information to our residents and those resources to our residents. So, Marlon, thank you so much for your partnership. I'm not sure if I'm going to hand this back to you, but we look forward to more conversations. Thank you.
Thank you, Commissioner. So you guys have heard it. Those are the facts. We know that in 2019, things were already bad, and we know that in the midst of the pandemic, we do have another issue that has arisen with the opioid epidemic. So without further ado, I'm going to bring up our project manager here for the African American Male Wellness Initiative, who will be leading this project, Ms. Tyler Allen.
Thank you, Marlon. So I'm Tyler Allen, and I'm the program manager, the Opioid Awareness Program Manager for the agency, African American Male Wellness Agency. And our initiative is to bring awareness to the Black communities around Ohio, well, Columbus, I should say, about the opioids affecting and even destroying our communities and our neighborhoods. So we've taken this campaign to our local barbershops, salons, churches, rec centers, and every other Black area, inner city area, where people really aren't talking about this issue and aren't doing anything about the issue. So we've kicked off what we call our Problem 2 tour. We're visiting businesses every week where we share information regarding the opioid epidemic. We provide these places with resources filled with opioid awareness, treatment center information to mental health public facilities, and as well as hosting monthly Narcan trainings. We've already started doing that, and other events where we can provide education to the community as much as possible. We've had some really good success stories from these barbers where they're telling us personal stories about how they've had people who are overdosing in their chair. They're nodding off, they're showing all signs of opioid addiction, as well as church members where people are just wanting to come in for help. Some people don't even want to ask for the help, and so we can provide these resources and these bags, just give them to the community and help out as much as we can. So I'm going to pass it back over to Marlon.
Thank you, Ms. Allen. I think the important part that Ms. Allen mentioned is that we need to take this information and these resources into the community, where those who are most hardest hit, the communities that are underserved and hardest to reach, need to have access to care and critical information. And with partnership with the Franklin County Public Health Department and the African American Male Wellness Agency, we can certainly do that. But this is an issue for all of us. And so we're calling upon everybody. We have barbers, we have beauticians, we have faith leaders, we have those who work in the mental health space, we have those who work in property management, estheticians. These are people who are going to be vital to ensuring the success of this campaign. And we want everybody to know that we stand united against opioid addiction and that we are here to help those who are in need. Without further ado, I'm going to bring forward Pastor Mike Young. He's going to share some information about the faith community.
Thank you, Mr. Platt. We most certainly just want to acknowledge the African American Wellness Agency and just all the incredible work that they do in our community to not only educate, but to just start initiatives like this that benefit Black and brown men and women. And it is a blessing, and we're just honored to be a partner. I also want to just acknowledge my brother and my co-laborer in the gospel in the person of Pastor Freddie, Lamar, who's here with us today. This is an incredible initiative, but it's also incredibly important for the faith community to be involved. You wouldn't think that an opioid epidemic would be something that would be synonymous with church as well. But the reality is this epidemic and these addictions don't discriminate. It doesn't matter whether or not you attend church or you don't attend church. The reality is this is reaching into all segments and sectors of our society. On a personal note, I've had to preach multiple funerals for individuals who have lost their life as a result of this epidemic. And one that sticks with me and I'll never forget is a 22-year-old girl. She was beautiful. She literally looked like a supermodel. She had taken what she thought was going to be a pain pill that was laced with fentanyl. And she dropped dead in CVS. Her heart stopped. And to have to go through that traumatic experience with not just her, but with her mother, with her father, with her grandparents, her siblings, and to see the heartache and the heartbreak that that family experienced, it became very real and relevant to me as a man and as a preacher and a pastor. So I encourage all faith leaders to get connected, to get in the game. I believe our assignment as faith leaders is not just to minister to spiritual needs, but also to minister to practical needs. And in the areas where we don't have expertise, we have the opportunity to partner with entities like the African American Wellness Agency. So I encourage everyone who can to get involved, let your voice be heard, use your platforms and your positions to get into the fight. So with that, I would like to pitch it next to Mr. Earnest Brown, who happens to be not just a barber, but a master barber.
Thank you. Again, my name is Earnest Brown. We're super excited to be partnering with the African American Male Wellness Agency and taking on this super important initiative. Me, myself, have experienced clients coming into the barbershop. I don't know if I was one of those, and being able to give them resources and point them in the right directions is something that's super important. And us as just being like on the ground dealing with people every day, I'm just glad for the African American Male Wellness Agency for partnering with us and allowing us to be part of such an important initiative. Thank you.
Thank you, Pastor Young and Mr. Brown. And so there you have it. You know, we've got testimonies to show you that this is a real thing in our community. That this is a situation that's going on in places that we live and work every day. It's happening to people who we know, both as friends, as family, as colleagues, as supporters. And so we all have a social responsibility to do what's right to help put an end to the opioid epidemic. And so we're encouraging everyone to go get Narcan trained so that you can assist. Our goal is to have every Black church in Columbus, so we're going to call on our faith leaders to help assist with that. We would like as many barbershops and beauty salons to have resources and also to participate in Narcan training so that you can be our boots on the ground. Because we know that with our partnership, not just with the African American Male Wellness Agency, but also with the Franklin County Public Health Department, in addition to our community members, we can truly make change. And so what I would do is encourage you to all go to the website, franklincountyrecovers.com. We'll share information and resources there. And then you can also find additional information about our community conversations and things that we have going on in the agency to really address this issue. And so what I would all like you to do today is just take a minute and ask yourself what you can do. Who can you talk to? Who can you bring in to be part of this great work that we're doing here with the African American Male Wellness Agency and Franklin County Public Health? Right now, I'd like to open it up for questions if there are any. Yes, sir.
Now, you said it's Narcan distribution. Now, what exactly is the distribution process? How are we going? What is going to be done, and how do you plan on distributing these out?
And so what you can do, and correct me if I'm wrong, you can actually go to the Franklin County Public Health website or Franklin County Recovers and there is a link for opioids on there, and you can press that button and to be able to request Narcan. Is that correct? I was on there this morning.
If you go to our website, myfranklincountypublichealth.org, you can actually take a training online, and we will mail a Narcan kit directly to you.
Yeah, so you don't even have to leave your home. You can do it all from the safety of your house. Yes, sir, Pastor.
The Narcan is an actor against what? Can you, like, if somebody got marijuana laced with fentanyl, can you use the Narcan to bring them back out of that?
It might be out of my
You know, we
system.
should have done. Thank you. You know, we should have done. We should have a mini training right now. You're gonna walk out of here with that's a great question. I'm gonna ask our staff to make a comment about that. Just a 30-second, Lindsay or Teresa, if you want to just do a brief comment because it's a great question. Basically, what Narcan does is it stops the overdose from happening. It binds into I'll let Teresa do it. It's a little more complicated.
Because I know about the Narcan, but I just thought it only works with certain drugs.
Only an opioid drug. So
Right.
if there's an opioid drug mixed with something else,
Right.
it would work.
So with the marijuana and the
It was
fentanyl,
just marijuana or, fentanyl is in a form of opioid, so it would work.
okay.
Yes.
Very valuable. Yes, sir.
Now, going on with this question, he's saying that with the marijuana, but if it's an opioid and you use Narcan, it will still work, but if it's not an opioid and they're having a reaction to something else, the Narcan will not affect, it will not harm them, correct? Correct.
That was a good idea, Commissioner. We should have just said everybody stop and look at the screen and just roped you all in for an impromptu Narcan training. Yes, sir.
Is there any partnerships with drug and alcohol counseling services?
So we are working with Adam H. For services, and we're also building a committee. Where's Luke at? Luke and Tyler are actually working on a committee that we'll be able to refer people to for additional treatment services. So those are the people you're going to see in the back. Yes, Brother Campbell.
Hey, good afternoon. I just want to thank you and your agency for doing what you're doing. I've been here only 3 years, but I can tell you, this initiative is very, very much needed, and specifically what you're targeting. So, I just want to thank you, man. I'm kind of overwhelmed, and that's why I'm here. And anything I can do to help support the initiative, I want to be a part of it, be a part of this healing. Thank you.
Thank you, Mr. Campbell.
Are there any upcoming Narcan trainings already scheduled?
Yes. Yes, we'll be having a virtual Narcan training, so once again, you can stay in your house, offered on April the 22nd at noon. 1 o'clock, sorry, 1 o'clock, they did change it. April 22nd at 1 o'clock. The Franklin County Public Health Department is administering that training. Thank you. Yes. Anybody else? Yes, sir.
I was just a little interested, do y'all have any age demographics of who's affected more or anything like that?
And so what we've really seen is that, one, it's affecting minorities. We're typically older men. I believe, Commissioner, you have some additional data to that. Let's go ahead and share.
So earlier I talked about the change that we've seen between 2019 and 2020. According to Dr. Ortiz, our Franklin County Commissioner, or Franklin County Coroner, when you look at age distribution, so really it's between 25 and 54 we've seen the most significant increase. 25 to 34, a 44% increase in overdose deaths. 35 to 44, a 45% increase. 45 to 54, a 48% increase. So that's really the age demographics that have been having the most burden. But overall, even the 20-24-year-old, 28% increase. So it's extraordinary change in what we've seen in terms of the amount
see, the numbers are going up across every age group. So I feel like amongst all of us in this room, we know people in that 18 to 24 demographic. We know people in that 25 to 44 demographic. We know people who are 45 and up. These are our people who are affected. And so while everything may seem okay on the surface, we do have to do our due diligence and make sure that we're looking for the signs and that we equip ourselves to be able to help. I think Ms. Seagraves made a good point that it starts with the youth. So we're going to be looking at doing some programming in the schools. We're starting some pilot program with the Academy for Urban Scholars High School right up the street here on East Broad Street. We do have their Dean of Students, Mr. Charles Jefferson, in the room. And so we're trying to catch it early. We're trying to make sure that we're creating good habits within the youth, within our communities, and that we're talking to them not only about the issues and dangers of drug use, but also the things that lead up to it. What's going into our mental health? What are we dealing with, and how we can use better coping mechanisms so that we can avoid using opioids or other drugs or alcohol. Thank you. Anybody else have any questions for me? All right. Well, thank you very much for your time and for tuning in. Once again, if you go to franklincountyrecovers.com, you can have more information. But thank you, everybody. Thank you.
I wanted to know if you wanted to say something about the pledge.
I couldn't remember off the top of my head. And I was looking at something.
Hey, do you have a couple seconds for?
Yes.
Okay.
Let me tap him first.
Okay.